Hello, Dr.
Hello, Dr.
Moses.
Moses. Yeah, hello, Mariam. Hello,
Hi,
Dr.
how are
Mariam. Hi,
you?
how are you? Yeah, I'm good. Thank you. How are you doing today?
Yeah,
Yeah,
fine.
fine.
Okay, Dr.
Okay,
Moses,
Dr.
we are
Moses, we are
very happy.
very happy.
I think there
I
is
think there is
repetition of my
repetition of my
voice.
voice. Uh-huh. I can hear you. There is no issues from my end.
Okay, so we are
Okay,
very
so we
happy
are
to
very
have
happy
you
to have
as a
you as
guest.
the guest.
So, welcome
So,
in
welcome
today's
in
live
today's live
broadcast.
broadcast. Thank you
And
so much. I'm
before,
very happy to be
you're
a part of
welcome.
the show. Yeah.
Okay,
Okay,
so before
so
having
before
you
having
in
you
today's
in
show,
today's show,
I was
I
having a
was
lot of
having a lot of
queries
queries
regarding
regarding
MRCP,
MRCP,
regarding
regarding
job
job
with having
with having
MRCP.
MRCP.
So let
So
me
let me
introduce all of
introduce all
you.
of
I'm
you.
having
I'm
today
having
Dr.
today
Moses
Dr.
with
Moses
us,
with us,
and he
and
has
he
done with
has done with
MRCP membership
MRCP
of Royal
membership of
College
Royal
of
College of
Physicians,
Physicians,
and he
and
has
he
done
has done
work in
work
United
in
Kingdom
United
and
Kingdom
South
and South
Australia.
Australia.
Okay,
Okay,
so apart
so
from
apart
this,
from this,
I
I
invite
invite
Dr. Moses
Dr.
to let
Moses
him
to let
introduce
him
by
introduce
himself.
by himself. Okay. Yeah. Hello, guys. It's very pleasure and pleasant to meet you in the evening time here. And I'm a medical registrar. Actually, to be honest, more than a medical registrar, I'm a specialty registrar in tropical medicine. Most people, I'm just because before anyone type and ask me what is a tropical medicine, I'll tell you it's a
Yeah.
substream of infectious disease, right? And tropical medicine typically deals with the infectious disease that prevails over in the tropical regions like
Mm-hmm.
India, Pakistan, and Sri Lanka. These are tropical countries. Even you go to South America. So I got specialized in that, and I have extensive internal medicine training, 3 years. And along with that, I have a degree in travel medicine, and I'm one of the obesity specialist consultant of Scope UK. Okay, that's
Okay.
about me. Okay. Yeah.
Yeah, that's
Yeah,
very
that's very
amazing about
amazing
our
about
guest.
our guest.
And well
And
done, Dr.
well done,
Moses,
Dr.
on
Moses, on
all of your
all of your
achievements.
achievements.
So let's
So
start
let's
with
start
your
with
journey
your
of
journey of
MRCP.
MRCP. Yeah.
So when
Yeah.
did
So
you
when did
started
you
this
started
journey?
this journey?
And
And
a lot of
a lot of
aspirants wants to
aspirants
know
wants to
about
know about
parts of
parts of
MRCP
MRCP
and
and
validity
validity
period
period
between every
between
part,
every path
and
and
requirement of
requirement of
experience
experience
basically,
basically.
and
Exactly.
another
And other
frequently asked
frequently
question
asked
is
question is
like how
like
much
how
training
much
period
training
is
period
required.
is required? Yes, yes. I'll answer everything one by one.
Okay,
Okay,
sure.
MRCP. Okay, sure. For me it started like the moment I just finished my internship, I decided like I just want to go abroad and get trained somewhere. So I had a lot of options right ahead of me. Like USMLE was there, and then Australian Medical Council exams, then PLAB, and then I also had Canadian MCQE exams. All these things were right in front of me, including Germany options, like where you have to learn German language and you can go ahead and you can become a specialty trainee there in
Mm-hmm.
Germany. So I have decided I'll just step into MRCP because of only one reason, because I love internal medicine.
Okay,
That's
that's
my
good.
favorite. That's good. So I just wanted to go ahead. But also I was aware, like there are many ways you can do MRCP. There are people who can sit back home and clear MRCP, but I wanted to go through a structured training pathway because I know otherwise I'll be in trouble. I have to see patients and I have to learn through patients, which right now we are trying to implement the same
Yes,
concept in
yes.
Yes. In our lecture. So I just joined my internal medicine training, UK based program. Then after that, throughout I cleared my part 1, part 2, and the clinicals throughout. That's how I started with the MRCP. In between I just had to clear my IELTS to get registered and get through all the JRCTB training and get the training competency signed off. That's how it started. And while I was doing MRCP, I was a bit interested in tropical medicine and as well as travel medicine. Simultaneously I was able to sit and crack 2 different exams. One is DTMNH and another one is PGDTM. That's again I've done from West Virginia University. And about MRCP preparation, what I would say is like it starts with your clinics and starts with the day one. And many people like so much confused between the paces part 1 and part 2. I am going to tell you one
Exactly.
actual Exactly. Truth. Part 1, part 2 paces are just the same. They are going to just test different
Okay.
thing, test the same thing in different way. That's the better way to put it. Okay, many people think part 1 is something theory, part 2 is theory, then after finishing the theory they can
Yeah.
go back and start working. It's not like that. Your basis learning starts from the day one. Trust me, I was a surrogate for so many basis exams. So I actually seen exams live and I know what is happening in the exams. So basis preparation should begin from the day one, from your bedside. It's not something you can learn in just last 6 months, 3 months, or like learn with some online coaching or something like that. So that's how I started my MRCP journey. That's how it ended. Now you can ask each and every question. I'm ready to answer and I'm ready to explain everything.
Okay, so
Okay,
the
so
first
the first
question,
question,
Dr. Moses,
Dr.
is
Moses, is
like
like
MRCP
MRCP
is
is
having
having
how
how
many
many
parts?
parts?
Okay, MRCP has three parts. The first part is MRCP part 1. This tests the basics of internal medicine, very basics, and it also tests your clinical sciences basic as well. Okay, the first part of MRCP, I would say one of the very important subject in the first part of MRCP is your clinical pharmacology. Almost 60% of the question will come around that. It doesn't matter whichever subject it is, even if it's going to be cardiology, even if it's going to be neurology, clinical pharmacology is the topic that is going to be tested the most. But
Okay.
MRCP part 1 is theory. So the second part of MRCP is going to go in depth in the internal medicine, where you will be tested with images of radiographs, ECGs, echocardiography, histopathology of the skin, and spotters from any skin disorders. Even on an odd day, you may even get a nerve conduction study, electromyography, pulmonary function test. So the candidate should be ready for everything. You should have some good basic internal medicine knowledge to crack that. The third part is obviously the clinical, the PACES examination. For that, for that, the candidate should have a very good, adequate clinical training to clear the exam in the first attempt.
Okay,
Okay,
so
so
can
can
you
you
please
please
tell
tell
me
me
about the
about the
validity
validity
period in
period
each
in each
exam?
exam?
The validity period Royal College gives around 6 to 7 years, but owing to COVID, they had extended 2 more years. So many people who have cleared in 2021 and 2022, they had extended now. For some people got a mail, some people sent their mails to me, some people got the validity extended till 2010. It's
Okay.
around 7 years you can take. 7 years from the day you cleared your MRCP part 1. Again, Royal College can extend, because some people I know who came to the end of the validity period and they appeared for the PACES examination, and they couldn't get through it, because one of my friend I know who is a gastroenterologist, that happened to him. So we just told him to just write back to Royal College, and they gave him one more chance, one more year to appear for PACES exam again and to clear. So validity typically 7 years. It can be extended. It's again in the hands of Royal College.
Okay.
Okay,
So,
so
can you please
can
tell
you
me
please
about
tell me
the
about the
requirement of
requirement of
clinical
clinical
experience
experience
before
before
appearing any
appearing
of these
any of these
exams, like
exams
part
like
one,
part
part
1,
two,
part
and the
2, and the
PACES?
PACES?
I would suggest clinical experience is must for every parts, but there is a notion that clinical experience is required for the last part, that is the PACES. Obviously, I don't deny that there are people who sat back home and they could clear MRCP 1 and 2. There is no denial in that. But for PACES, for sure, I would suggest at least 2 years of a clinical experience, if not at least 1 year of full swing clinical experience you will need in a good hospital where you can see a lot of cases. And second thing, you should be under a good mentor, a person who can guide you properly, someone with an MRCP or some good internal medicine degree, especially some Royal College degree. Maybe a consultant would be able to help you with that. Without the clinical experience, MRCP is not going to hold any value.
Okay.
Okay,
So,
so
do you think
do you
that
think
training
that
in
training in
internal medicine
internal
is
medicine is
necessary,
necessary,
or any of
Yeah.
the
or any of
subfield
the
of medicine
subfield
can
of
be
medicine
accepted?
can be accepted?
Any of the field of medicine can be accepted there. Anyone can write MRCP and clear, because I know some pediatricians who have cleared MRCP and they're having MRCP next to them, and there are people who are doing like non-clinical subjects like preventive and social medicine. They have their MRCP as well. But where it will reflect is in the interview and in the job. You will definitely see a huge difference between someone who's trained clinically or coming through a proper training pathway, and someone who just sat back home and just somehow hook or crook he cleared the exam and coming out. Like, it will be revealed over there if they start working.
Okay.
Okay,
So, another
so
question
another
right
question
after this
right
is,
after this is,
what is
what
next
is
after
next after
MRCP? Like, there
MRCP?
is
Like
any
there
kind
is
of
any
fellowship
kind of
exam?
fellowship exam?
Okay. Next after MRCP depends on the person's previous qualification. Okay. I will come one
Okay.
by one.
Okay.
If the person is already having some good degree, like for example, if he has done some FCPS from Pakistan and he's having an MRCP, or he has done a MD or DNB internal medicine from India and he's having an MRCP, he can start working at a registrar level based on his competency. He can start working as a registrar level, and then after working at a registrar level, he can maybe after a year he can apply for some training post. okay,
Okay.
training post, okay, where he can go through the CCT pathway, certificate of completion of training. That's earlier it used to be CCST, certificate of completion of specialist training. Now it is
Okay.
CCT pathway. Okay. He can go, for example, if I have done some FCPS and I've done MRCP, and then I can go to the UK and I can start finding a job. Maybe if I wanted to be a neurologist, I can find a job, try to find a job in some trust where some I can work as a neurology registrar, and I have to go through all the competencies, get the competencies signed off, and appear for my CCT, and I can get my CCT and become a consultant. This is one way. And there is another way. They can use something called CESR pathway. Okay, the
Okay.
certificate of eligibility for specialist registration. That's called a CESR. Here, there will be some consultants. For example, some consultant is coming from India. Maybe he has done his DM nephrology. He is a consultant nephrologist, and he can clear his MRCP, come to the UK, and get his competencies, that he is already having a competency of a consultant because he has already done a subspecialty degree in the particular country. He can show off the competency and he can work as a consultant in UK. That is called CESR pathway. Pathway number 2. Pathway number 3 is the regular pathway, like us, who has done the IMT, internal medicine training, and who have cleared the MRCP. They can skip all this painful things and they can directly go into specialty training. But again, there are interviews to be cracked and your CV should be strong enough. This is one more thing. The fourth different thing is somebody has done their MRCP. Just maybe you take someone just after MBBS, he has done his MRCP, and there are clinical gaps and there are ifs and buts in his profile, in his CV. He can go ahead and start working. Nowadays, a lot of posts are coming up as junior clinical fellows and senior clinical fellow. He can go ahead and start working as an SHO level, and he can just gradually step and get into some training post at a later point of time. These are the ways that are open for MRCP in UK.
Okay.
Okay.
So
So
let me share
let me
some
share
words
some
like
words
about
like
your
about
working
your
in
working in
South
South
Australia.
Australia. Yeah.
So
I
what
was. So
was your
what was
post
your
there,
post
and
there,
what
and
is the
what is
scope
the
for
scope
doctors
for
after
doctors
doing
after doing
MRCP?
MRCP? Yeah, actually, I was not working as a. I went over there for a project. I went over there for a project where I was
Okay.
associated with. Okay, for tropical medicine, because basically Australia, you cannot just jump into MRCP easily with MRCP easily.
Mm-hmm.
Australia, you need to have a good UK experience, minimum 2 to 3 years. Actually, I've tried that. To be honest, I've tried that. Tried to get a registration there. It's not that simple, because Australia, they somewhat prefer this people who are fresh out of plab 1 and plab 2 with some 1 or 2 years UK experience. They are pulling them and they are putting them as their uh, as their ward doctors or the the GPs and all. But MRCP, you need to show some competency. This competency should be accepted by RACP, that is Royal Australasian College of Physicians. They should accept the competency. If the competency is accepted, then you can get registered there, and 1 year they will observe, then they will give you a permanent registration, then you can work in New Zealand or Australia. Basically, I went for a tropical medicine project which I've done and then came back.
Okay.
Okay,
Please
so
let me
please
know
let me
about
know
some of the
about some of the
subfields of
subfields of
medicine.
medicine.
Like
Like
it is
it is
decided
decided
after
after
the
the
taking
taking
exam,
exam,
like
like
in
in
which
which
doctor
field the
has to
doctor
go.
has to go. Yeah, I feel the doctor has to keep his mind very steady, and he should decide even before stepping or applying for any exams for subspecialty. To be honest, in UK, the specialties are divided into two: Group 1 and Group 2. The Group 1 specialties are your neurology, your cardiology, your rheumatology, nephrology, and all these things are Group 1 specialties. And Group 2 goes like your tropical medicine, your aviation medicine, occupational medicine. These are Group 2. First, someone should make their mind very clear where they are going to head to, so they should work their competencies based on that. For example, if I want to become a neurology registrar, I want to get into a neurology trainee. That happened to me recently. I got, actually, to be honest, there is nothing shameful to tell this. I'm openly telling. I got kicked out of a neurology interview. Okay. The
Okay.
question asked, like, you wanted to become a neurology specialty trainee. That's fine. They asked me how many research you have done that. Have you conducted any surveys? Do you have any paper on that, or
Okay.
have you done any audit on that? Unfortunately, no. My entire thing is full of tropical medicine and ID. So if you want to become a specialist in particular field, try to have some competencies on that particular field, because your CV should speak for that. You cannot just like that write an exam and do that, because a lot of people making a mistake. They think they, by writing this specialty certificate examination, and they can just go ahead and become some specialist, and it's not like that here. They should decide either they want to go to group 1 or group 2. From the beginning onwards, they should have something on it. Just try to put some case reports, try to do some audit on it, try to get some good letter of recommendation from someone who is just like, big head or big shot in that field. All these things plays up a role.
Okay.
Okay.
So,
So,
Dr. Mehta,
Dr. Mehta,
let me. I just want
I
to
just
ask
want
about
to
the
ask
pay
about the
scale of
pay
the
scale of the
doctors
doctors
after doing
Okay.
after doing
MRCP both
MRCP
in
both in
Australia and
Australia and
United Kingdom.
United Kingdom.
Yeah, pay scale typically it varies with different trust. It varies with the region. Okay, typically if you go to the places like London, the pay scale will be high. Of course, the cost of living is also going to be high. If you're going to go to the Scotland or like Glasgow, where I was from, Edinburgh, the pay scale may be slightly lower than what you're going to get there. But again, the cost of living is not high as that of a typical urban place like London or any other place surrounding there. So what I would say is, nowadays the pay scale also depends on the person's experience, because post MRCP some people are starting as senior house officers, SHOs. Their pay scale will be somewhere around, like I would say, close to £3,000, 3,200 pounds. It depends on different trust. And some people will start as a registrar, somebody who has just already done some IMT or already done some MT, TNBF, CPS or something. They will have a good competency. They're going to work as a registrar. They can get somewhere plus 4,000 pounds, 4,000 pounds plus. And above that, if you are good enough to go ahead and just do some locum jobs, you can get decent pay. You can make up to 6.5k pounds for sure.
Okay, so
Okay, so there comes another question.
How much
How
time
much
is
time is
required
required
for
for
getting
getting
registered to
registered to
GMC
GMC
after
after
doing
doing
MRCP?
MRCP?
Okay. Again, GMC registration depends on like how good you're submitting all your proofs. Like as soon as you completed your MRCP and you have your English exams ready in hand, and you have everything, like they will definitely ask explanation about what you have done from the moment you stepped out of medical school. If your profile is so clean, you don't have much gaps, career gaps, or you don't need to give them any explanation at all, within weeks also I have seen people getting registered from GMC. I have also seen people waiting for 6 months and 7 months because of career gaps. And there are people, I'm openly advising certain people, please don't ever lie to GMC. I worked here or there, and people give experience certificate of some hospital that are completely non-existent. Trust me, there are people from Asian countries like Pakistan, India are sitting in GMC. They know about us very well, what these people will do, what kind of hospital is going on. So when you try to do some kind of things like that, they will hold the registration back. So whatever it is, be honest. So if you keep everything on paper ready, I don't think there is not going to be much delay to get GMC registration. If there is going to be ifs and buts and gaps that you cannot explain properly, maybe 2020 they will accept. They accepted my 2020 gap. Even in interview they accepted, because everyone know the world was totally shut down. So if you have a proper answer, they will accept that. Otherwise, it will keep delaying for months together. If everything is apt and appropriate, weeks only it will take. You will get it done in few weeks.
Okay,
That's good.
So,
You talked about English language exams. So OET and IELTS both are acceptable?
Yeah, both are acceptable, but the thing is, you have to clear both the required band in just one setting. Okay, because some people think OET allows to take 2 modules again. Like that you cannot do. Whatever it is required, you have to do it in one sitting. For me, I took IELTS. I had to give 7 bands in all the 7.5 in everything, all the 4 modules. I have done that, and my overall band was 8. So you have to do it in one sitting. So make sure of it. You are prepared really well and crack it in one attempt.
Okay.
Okay.
So is it necessary to take language exam before appearing in MRCP Part 1?
No, definitely not.
Okay, so
Okay, so it is
basically
required for getting registered to General Medical College.
Exactly. Only if they want to go and get registered in GMC, the language exam is required. Okay. Then otherwise, it's not required.
Okay.
Okay.
And
And
please tell me
please tell
about
me about
the global
the global
classification of
classification of
MRCP
MRCP
exam. Other
exam.
than
Other
United
than United
Kingdom, like
Kingdom, like in which of the
other
other
countries it is
countries it
globally
is globally
recognized?
recognized?
Okay, MRCP is kind of worldwide recognized degree, but I'm afraid to say it's not accepted in US, it's not accepted in Canada. And when it comes to Canada, there are two consultants I know that now they went to Nova Scotia in Canada. But that's not with MRCP alone. They have done their MRCP, they have done the CCT, and post CCT they had 4 years work experience, so they were picked up. So in the north day, and again in Australasia, like I said, your competency should be good and you should have UK experience. Like what they are advertising here and there, like you have MRCP, just like that you can jump to Australia or New Zealand. Not like that, because I've tried, it's not going to work that way. And other countries do accept, it has a good acceptance in Middle East, but they are asking post MRCP experience at least 2 to 3 years. Rather than picking up freshers, they are after someone who has MRCP and they have some good post MRCP experience. And definitely MRCP with the UK experience is accepted more than MRCP with the experience in any other country, to be honest.
Exactly.
Exactly.
Yeah.
Okay. So
Okay,
Dr.
so
Mrs.
Dr.
Another
Mrs.
question
Another
comes.
question comes.
Um,
Um,
what
what
about
about
Rota and what
Rota and
about the
what about the
hospital
hospital
timings?
timings
For the one
for the
who has
one who
done with
has done with
complete
complete
MRCP,
MRCP,
both in
Okay.
both
United
in
Kingdom,
United Kingdom,
hospitals, and
hospitals,
any of
and
the other
any of the
country
other country
hospitals?
hospitals?
Hospital, you mean the timings?
Exactly,
Exactly,
timings, doctor
timings,
timings.
doctor timings.
Timings will be 48 hours in UK.
Okay.
48
Okay.
hours is the working hours in UK. Beyond that, they won't. Like there will be a duty day, post duty day, they will give you some leisurely off. And other countries also same, but there are countries that will make you work for even 56 hours. There are countries
Exactly.
like that.
Exactly.
There are some jobs, it depends on the jobs as well. If you are working as an SHO or a registrar, there are some clinical fellowship. I'm seeing a guy here who just got a clinical fellow, junior clinical fellowship in rheumatology. He's working just 36 hours a week, that's it. He's just going, seeing some cases and writing some papers and helping his registrar and consultant, and then coming back and sleeping back at home. It depends on what kind of job you're taking.
Okay.
But
Okay.
again,
Okay,
they're
okay.
strictly 48 hours. No one can force you to work beyond 48 hours.
So for
So for
clinical
clinical
pharmacists, as you
pharmacists,
told
as you
us
told
that
us that
a guy is
a guy
working
is
for
working for
clinical
clinical
fellowship in
fellowship in
rheumatology.
rheumatology.
So there
So
is
there
another
is
exam
another
required
exam
for that
required for
clinical
that clinical
fellowship.
fellowship.
Clinical fellowship doesn't require any examination. You just need to crack the interview. You just need to crack
Okay.
the
Okay.
interview. Yeah.
So
So,
in your
in your
opinion, what do
opinion,
you
what do
think
you
that
think that
which country
which
is
country
best
is best
suitable
suitable to
after
work
doing
after doing
MRCP?
MRCP?
I would say UK is a decent place to work post MRCP. And if you actually want to have, like, to be honest, like you want to actually start saving a lot, you have to go up to a consultant level. Okay, to see some decent amount of money. Or else with UK experience, if you go to Middle East, definitely you can have a very decent lifestyle. And depends on which
Okay.
country you
Okay.
are going. If you are going to a country like that, and if you are lucky enough you go to Australia, then that's it, you are settled.
Okay. So
Okay, so
let's
let's
have some
have
words
some
about
words
the
about
pros
the
and
pros
cons
and
about
cons
life
about
in
life
UK.
in UK.
Okay, life in UK, the pros will be like you can get into specialty training, things are fine. But right now I would say there are a lot of cons. Starting with the inflation, things are getting little difficult. Even the job situation also getting difficult these days, because
Hmm.
what is happening is like people are coming and they are going for a job for a year or two, and they are shuffling back and running away. And some people will not stand the stress of actual job situation in UK. Recently that happened to one person I know, and she has been offered a job as a locum consultant in acute medicine, and she took the job because it's a
Okay.
good money. They gave her a very good package, so she was happy. She just went and she just joined. Within 3 days she could not stand the pressure, and she quit totally and came back all the way. So life will be, initially it will be tough. You need to get adjusted. If you want a very calm peaceful life, go back to areas like Scotland. You will have,
Okay.
you want
Okay.
away from all the city life, and you want to just like, it depends on people. Some people will be used to city life, they used to get running around. That's fine for you. If you want this, you have to go little away from the main part of the UK, and you have to go to the Scotland, you have to go to the Glasgow, Edinburgh, or somewhere like that. And life right now, there is inflation, but UK will definitely recover from here, and it will come up.
Okay, so as you have mentioned, Scotland, Edinburgh, and Glasgow. So can you please tell me there is an other entrance pathway,
No, nothing.
like any of the exam or GMC is enough?
No, GMC is enough because Scotland and Edinburgh and London, these are the three locations of the Royal College. Okay, all comes under the one MRCP now. Because earlier they used to have MRCP-E, MRCP-G, and MRCP-L like that. They used to put MRCP London, MRCP Glasgow. But now all three of them are coming as a federation of Royal Colleges.
Okay.
These three. Only Ireland is out now because they are independent. That's why they have their MRCP-I with them.
Okay. So, do you have any knowledge about MRCPI as you have mentioned about Ireland?
I don't have much knowledge about MRCPI, but I know
Okay,
a couple
don't
of
worry.
people who are doing that, and yeah, that's all I could say at the moment.
Okay, Dr. Moses, I have having this theory regarding exact source of preparation. So, what do you say about it? Because I know that there is not a single source for preparation of any of the membership exam.
Okay.
So, what do you think that what would you suggest to the aspirants?
I would suggest first source should be your own patient. Learn from from the bedside. In theory, if you want the most authenticated and most appropriate source, it's going to be your guidelines. There are guidelines, NICE, National Institute of Clinical Excellence. Okay, and second guideline is your SIGN guidelines, Scottish Intercollegiate Network guidelines. Number 3 is your ESC, all your European Society of Cardiology, European Society of Nephrology. These are the guidelines that is being followed in UK. When it comes to ID and tropical medicine, which is my field, they used to follow guidelines from CDC, they used to follow guidelines from WHO. So these guidelines are the right source for you. Plus some good MCQ you have to work out. You have to work out your MCQs from a good source. Many people, what they do is they just get random notes from random people and they start reading. They think that will give them enough knowledge in internal medicine. That's not, because these notes are written by some other consultants maybe 4 years, 5 years back. Now everything is updated, everything is being updated, and MRCP is also changing their way they are going to ask the question. They are very well aware how people are preparing. They want to make sure the doctors are updated. So guidelines are the first thing I would suggest. If you want to take one textbook and prepare, there are textbooks like Oxford Handbook of Clinical Medicine and Kumar and Clark textbook of clinical medicine, and these books are more than enough. But more than books, I would suggest guidelines and try to learn from your patients. That's what I would suggest. And if you want a book, you can use this book. There is no specific textbook per se for MRCP.
So, as we are talking about the source of preparation, please let the student tell about the paper pattern exactly.
I'm sorry?
Pattern of the paper. Like it is an MCQ paper.
Yes, exactly. The MRCP 1 is going to have 200 MCQs. The first 100 MCQs you are going to work in the morning with 3 hours. The second 100 MCQs you have to finish in the afternoon. Another 3 hours will be given to you. That's what MRCP 1. MRCP 2 also the same thing. MRCP 2, they will give another booklet for your pictures, your other data interpretation, like your histopathology slides. So you'll be given another booklet, so you have to work it out. So both the exams 200 MCQs, and paces, of course, 5 stations. Now 2023 they had made some changes here. So station 1 you are going to do 2 clinical cases, then station 2 typically you have a history taking station, and station 3 clinical, again station 4 communication, and station 5 again you will be doing a brief clinical consultation, which is now replaced with clinical consultation in PACES 2023.
Okay, and what about the preparation time? What do you think that which time period is best to prepare the exam? How much preparation is required for this part 1 and part 2?
Part 1 and part 2 depends, and I would say if someone who is so strong in internal medicine, or someone who is already an internal medicine resident, or is in a good internal medicine pathway, I don't think it should take more than 4 months for that person. 3 to 4 months is more than enough if someone is a strong person in internal medicine. And someone who wants to who are mediocre, someone who is having a moderate knowledge in internal medicine, maybe another 6 months should be enough for that person. And someone who wants to start from the scratch, just there are some people who don't even know the basics.
Exactly.
It will take a longer time than that, maybe 8 months plus.
So there is another query that is ambiguous enough to take MRCP Part 1 and Part 2.
Yes, exactly. It's more than enough.
Okay, so there is no need of internship or house job.
Yeah, internship. I mean MBBS. I included along with internship. That means like you get a complete degree, because like you get a complete degree once you've done the housemanship. So MBBS plus housemanship. That's the basic requirement for MRCP 1 and 2.
Okay, because in some of the countries it is not included in the complete
Okay.
MBBS, and internship is a different thing.
Okay,
So that's why that's
okay.
my question.
Housemanship is very important. Unless they haven't done that, they are not accepted.
Okay. So, Dr. Moses, please tell us that what are the chances of getting job on basis of MRCP? Like we have seen many of the people who has done this lab and in UK. So the question arises here. Person question me that I have done this lab, but I am not getting a job in UK. So the point is it advisable to done with my membership exam so that it will boost my CV?
Okay, if you have done PLAB and you are not getting job, you have to just go back and read your CV where you have made any mistake, because your CV is like a trailer, because based on a trailer you will judge a movie. You have to write the CV very appropriately, and you should have something that should impress the HR on the first look. Okay, whoever is going to take your interview, it should impress. You should build your CV properly. If you cannot build your CV properly, please take help from someone who is already working in UK, and they let them help you to do that. And if you have not got a job post PLAB, please see to this first, then start applying. And second thing, I would say, if you want to take membership exam, see, PLAB is a general entry exam. Now PLAB is replaced by UK MLA. So make sure you only want to become a specialist in medicine, or you want to choose any subspecialty in internal medicine, then you take MRCP 1, because some people post PLAB, they may be having an idea of becoming a surgeon, then there is no point in taking MRCP. Some maybe want to work in obstetrics, there is no point in taking MRCP. So make your mind very clear. If that is your thing, you can write MRCP 1, because I know some people post PLAB, they write MRCP 1 and 2, they will have a better chance for getting a job. There is no doubt in that. A PLAB candidate with MRCP 1 and 2, they will have a better chance in getting a job. That's for sure.
And what kind of job will you get? Like I'm asking about the job grade. Is it SHO1?
SHO. If they have MRCP 1 and 2 post PLAB, they can get a SHO job. Okay, but they again depends on the experience they have, and again it depends on the CV. Otherwise, they will throw you into FI1 or FI2.
Okay, that. Okay, so Dr. Moses, as we were talking about good CV, so what do you think that for internal medicine resident who has done with MRCP, what are the points in her CV?
Okay.
Yeah.
I got it. So CV, there are certain things. First thing, make sure there are not much of clinical gaps. Okay, we all tend to have gaps. Okay, even I have some gaps. Exactly. Okay, it's perfect to have gap years. There is nothing wrong. Everyone has gap years. But make sure you will be able to explain your gap years. Second thing, the most important thing which they are looking at your CV is, have you done any audits? Audits do count. And people who are not aware of audits, just please take some course on audit, and you can do audit easily. You don't need to have a big setup unless you are in UK, because UK audit is very strict. You have to do very systematically. If you are in any other country other than UK right now, you can easily do an audit. Even from a small secondary care hospital, you can do an audit. Do a couple of audits and keep. Do a couple of quality control and keep. And do have some publications that is relevant. Please don't pay and get your name published in anything, because if they started asking cross questions in interview, you will get caught. Because I know a guy who have done that. He wanted to get into internal medicine specialty training. He has some of the publications. I don't know, hook or crook, he just paid some money to some surgeons, and he got publications in general surgery. They started probing him on the interview about that. He got caught, he got just completely off guard. So what I would say, even if you can't, you don't need to do a big research to publish anything. All you have to do is just find some case study or find some research, just write a critical appraisal of that. That's it, you'll be published. just publish some case reports, have some publications. So these three things are very important. Get a good CV and try to explain your clinical gaps. Number two, try to have some audits, because they are very peculiar about audit. If you get, I'll just show you, like I can't share my screen now. I'm ready to show how a typical good NHS CV should be looking like. Okay, because GMC specifies this. Audits are very important, and so do publications are very important. If you have this, your CV will be super strong. You will just pass through other people.
Okay, thank
Yeah.
you.
Okay, thank you.
So there is
So there is
another
another
question
question
in
in
the
the
comment
comment
box,
box,
and
and
someone is
someone is
asking,
asking,
some
some
doctors do
doctors do
FRCP.
FRCP.
How
How
is
is
that
that
different
different
from
from
MRCP?
MRCP?
Okay, no one can do FRCP actually. FRCP is a fellowship that is conferred by college.
Yeah.
Okay. Yeah. I done MRCP now. Okay. Now I can't become an FRCP. I have to wait minimum 10 years for the college to give me FRCP. But however, in the next couple of years, I'm in like working really well. I'm just publishing a lot of papers, and I'm doing really something better for the college. And some of the members in the college can actually write for me and vote for me. Okay, this guy is actually a good person. He's like a good candidate, and you can give him fellowship. If they recommend me, there will be a balloting system, and based on that, they can give me fellowship. That's how anyone becomes an FRCP from MRCP.
Okay, so
Okay, so you are saying that there's a time period required of
Yeah, there
around
is a
10
time
years.
period required. If you want to bypass the time period, you should have done something exceptionally well. Exceptionally
Okay.
well. Okay, but some people got it little earlier, because they have been recommended by so many people. Some people who have actually, there are some doctors, especially during the COVID time, they were like pillars for NHS. They just lifted up things and they just worked hard. So those people have been easily got conferred with FRCP.
Okay.
Okay.
So Dr.
So
Moses,
Dr. Moses, there is another question
by
by
Dr.
Dr.
Javed,
Javed,
and
and
he's
he's
asking
asking
that,
that,
is there
is
any
there
online
any online
subscription for
subscription for
preparation of
preparation of
MRCP
MRCP
exam?
exam?
MRCP 1 and 2 exam, 1 and 2, there are a lot of online subscription. Like you can very well come ahead and take a look at our lectures. Also, we have Med Expert, and there are subscriptions like you can subscribe to
Exactly.
Test and all those things. Only thing I would ask you to do is like go ahead and take a demo session of any subscription and see who is just close to the guidelines, who's teaching you more clinically, and go with them.
Okay.
Okay.
So,
So,
Dr.
Dr.
Moses,
Moses, thank you so much for your precious
time.
time.
And
And I would like to share some words
and
and any of the message for the upcoming aspirants of MRCP.
Okay, upcoming aspirants of MRCP, just
Yeah.
remember one thing: this is a exam that tests your clinical knowledge. So try to learn things clinically, and try to work hard, and try to crack the exams fast, and try to get into the UK setting at the earliest. Okay, without wasting much time, because we don't even know what is awaiting us, because exam patterns are changing. Okay, now 2023 we have a new PACES format. What is going to happen for the part 1 and part 2, we don't know. So try to just like speed up things. Okay, I wanted to tell you one more other thing here.
Yeah.
Like
Yeah.
GMC registration pathways, some of the people ask me personally, so I have to tell that. What are the ways post MRCP someone can register in GMC? First, with full MRCP you can register in GMC. Second thing, there is a pathway called the MTI pathway. If you are actually good, to aspirants who are really preparing well, maybe if you have some 2 years postgraduate experience in any particular field, like cardiology, neurology, or any field, okay, or even in general internal medicine, with MRCP part 1 and with an English exam score, you can get GMC registration, complete permanent GMC registration through MTI, that is Medical Training Initiative pathway. 2. Third thing I want all of you to know is there is another pathway called sponsorship pathway. If you go to GMC website, there is a sponsorship pathway. In India, there is an association called BAPIO, that is British Association of Physicians of Indian Origins, and there are a lot of trust, Guy and St. Thomas, Royal Wolverhampton Hospital, Royal Infirmary Scotland, all these people can sponsor you for a GMC registration post MRCP part 1, and in English exam they can sponsor you. So keep looking for all these pathways, keep preparing well, and have your clinical basis so strong. If you get time, please do some audits. It won't take much time if you are going to do audits in India, and have something published in your name. That's essential. That will actually give a huge weightage to your CV. Like I said, you don't need to go ahead and do any research, just do some publication. Or if you don't find anything to publish, just go to your own hospital, see some interesting case. Even if you don't find it in your own hospital, go to some government hospital and you will have a lot of cases. See some interesting case, get the data and publish it as a case report. You don't need to immediately try publishing in some NEJM or some Lancet or BMJ. You can publish in any simple journal. Start from there and have something and start building your CV now. CV is not something you are going to build after finishing your paces. That's one of the advice. And learn things clinically and learn things thoroughly and learn things with a good foundation and fundamentals. Because if you're not good in your fundamentals, it's going to be spelling trouble for you. And one more thing about paces. Paces is not something you are going to prepare after part 2. Try to prepare for paces from now on. You don't need to do anything. You don't need to do any online course or anything. Just examine a patient at least 5 minutes a day. That's my one request, because I learned the lesson in a very painful way. Please try to examine even one patient at least 5 minutes a day. Even if you're not getting a patient, it's perfectly fine. Examine someone in your home. Just one system. Today I'm going to do some cardiovascular examination. Just try to do that. So start like that and keep all the competencies ready. In no time you'll be in UK.
Yeah,
That's a very good advice, Dr. Moses. So I'm having another query. Someone is asking like which route is better to get registered with GMC in a very quick time,
either
either
PLAB
PLAB or either MRCP.
Okay. PLAB is a shorter route, I would say. Okay. PLAB is a shorter route. If you have all your competencies, if your CV is good, and PLAB is a shorter route, because once you get a PLAB 1, immediately you will get a PLAB 2 slot and you will do. MRCP, the issue with waiting time for paces. Even people like me with IMT, we had to wait for a while to get a slot. Otherwise, unless and otherwise you are going to apply for UK, you will have to wait for a while to get a slot. That time may prolong because some people are getting in the first attempt, I don't know how, and some trainees like us, we are in the preferential list, we will get pushed through. And there are people who are waiting even for the 12th attempt, the 13th attempt, and 2 years and 3 years. That's the actual bitter fact. And last time we just raised the issue to MRCP and to the RCP people itself. So they are trying to work out to increase the centers now. Now one center is going to come in Bangladesh, and today they see in Pune center, and even in India, Chennai center is going to increase, and even in Pakistan they are trying to pull up more centers in. So that's the one issue with that. And if you want to get registered properly, MRCP is good and PLAB is also good. There is no doubt in that. But time difference matters a lot. PLAB is kind of quickest. Yeah.
Okay.
So there is one last query as we were discussing about different pathways, and there is a question regarding MTI scheme.
Okay.
So
if person go to UK on MTI, so he will be having a permanent registration of GMC, and is there anything like that he have to leave UK in 2 years?
Okay, they are going to give a permanent registration and a tier 5 visa. Okay. If you can crack your MRCP2 and paces when during the 2 years time, you can extend your time period by finding some other job offer there and get this degrees registered by GMC and also get your EPIC verified. Okay. If you are not able to do that, then in 2 years you have to come back to your hometown.
Okay. So thank you so much, Dr. Moses. You have answered all the questions very well. I hope that after this podcast, no student will be having any query in his or her mind.
Yeah. If anyone has any queries, they are more than welcome to approach us, MedExpert. We are always here to help them.
Yeah, exactly.
So thank you
so much, and thank you all my viewers for seeing today's podcast.
So
let me introduce Dr. Moses in another way, like he's a mentor of MRCP on MedExam. So all of you who are waiting for the preparation of MRCP or the language test, kindly join us. I being a mentor of OET and Dr. Moses being a mentor of MRCP, we highly welcome all of you to join the exact platform of preparation, which is MedExam Expert. So thank you all for your precious time.
Yep. You all are most welcome. Okay. Thank you, Dr. Mariam. Nice meeting you.
Thank you, Dr. Moses. Thank you, everyone.
Thank you.
Goodbye.
Goodbye.